right?
Okay.
Hello?
So what else complications you will explore?
The child can go in celiac crisis. Okay. There can be dermatitis herpetiformis. The most important is, though rare, is lymphoma, intestinal lymphoma. Then there can be osteopenia.
Yeah, osteopenia is also.
And
So do you ask any questions related to it? You are asking about bone pain, right?
Bone pain I asked, yes.
Yeah, you are asking about bone pain, yes.
Developmental and growth and pubertal delay and iron deficiency anemia.
Yeah, short stature, pubertal.
Short stature. The celiac crisis, it presents with abdominal distension, dehydration, electrolyte disturbance like hyponatremia, hypokalemia, hypocalcemia, hypoalbuminemia. Should be treated with steroid.
Okay. So you asked about the pregnancy and all those things. In your differential, what do you want to rule out if you wanted here the main history? You asked, I said normal, but if there was...
Cystic fibrosis.
Yeah, cystic fibrosis and meconium ileus presenting with meconium ileus or something like this.
Cystic fibrosis, I want to rule out. I want to rule out. In this age, I won't take IBD into consideration. Inflammatory bowel disease, and I ruled out from the question. But they have
inflammatory bowel disease will present from the age of 1 year.
No, that is what I ruled out by the age. And there are alternate, like it is usually bloody diarrhea. Here, it was not a bloody diarrhea. And yeah, and usually they don't present with such like 0.4 centile, not that much failure to thrive. It is some malabsorption kind of the picture.
Okay, yeah, for me, I think you covered most of the points, but you were mixing things up, down from past history to then again present history like this. Even in family and social history, you went to social history, then you went to family history, then you came back to social history like this. Make it at once. When you ask about family, ask everything. Are you and your husband, relatives, anyone in the family have same problem?
Yes.
How many children you have? They are all fine like this at once. What do you work like this? And then when you come to social history, first is the impact which you asked about with the child and the mother. And in the diagnosis, okay, you can put celiac disease as the top, and then you can say malnutrition or malabsorption in general as second, rather than telling protein losing enteropathy. But it's okay. I think not a bad differential. CF you put in the third and immunodeficiency in the last, because in the history nothing much was suggesting for you. And more than worm infestation, for the flushed, difficult to flush, which which parasite infestation you think more?
Pinworm.
Pinworm will cause stools difficult to flush?
No, diarrhea. Pinworm will cause diarrhea.
Okay, so giardiasis, right?
Giardia. Yes.
Yeah, you can consider, but I don't think in giardiasis there will be like acute weight loss like this.
I didn't ask for the foul smelling. I forget to ask about the foul smelling.
But I told that there is also smell in this.
Okay.
Regarding the regarding the specific investigations, so now the recent guidelines you will do to start with total IgA and what you said, tissue transglutaminase, right? Tissue transglutaminase. You will IgA. You will do tissue transglutaminase IgA to check this is the starting investigations. If it is more than 10 times, you will do one more blood test before confirming. What is it?
IgA, before IgA transcriptional glutamase, I will do the CBC, the inflammatory marker.
No, they are just supportive. No, for the specific diagnosis, diagnostic tests I'm asking. You did total IgA, and then you did transglutaminase IgA. You got more than 10 times the value, right? So you'll do one more. You'll take one more sample test.
Anti-endomysial antibody, you mean?
Yes, you will do anti-endomysial antibodies. Then it will be confirmed.
Okay.
Okay. And if it is less than 10 times, as you rightly said, you will discuss with your consultant, and the gastroenterologist will be involved to discuss about the duodenal biopsy. Okay.
Yes.
Now in the recent guidelines, we will go through the guidelines now. In the recent guidelines, they are telling
Dr. Fatima, the Ashpan guidelines.
Yeah.
Let me forward you on the group because
No,
they follow.
I have with me. I will share now. We can go through it. But what I want to tell you is one more thing. Nowadays, they are telling this HLA testing and these symptoms, they are not taking into consideration for the diagnosis. Like before, we had the symptomatic child, some criteria, asymptomatic child, some criteria. I will share that. We can go through it. No problem. So for the management, mainly you will say here that you will, if the diagnosis is confirmed, immediately you will start with the gluten-free diet, and the dietitian will be involved, and mother will be educated regarding to check the labels in the, whenever she is buying the food for the child. So she has to join the support groups also, and she may also need the financial support, because you know that the they may need to spend some, because now she has to be very strict about the diet, gluten-free diet, and she has to be assured that with the strict diet compliance, her child may grow well and have a good weight gain. But the only thing you have to instruct is the diet compliance, and so the mother is worried, so you can give her some psychological support, education, dietitian. These things are more important here than gastroenterologist. Why you said endocrinologist here? For complications?
Because associated with diabetes mellitus and or other autoimmune disorders like thyroid and all.
You can say only if associated, but for this case, right now, I think she doesn't need. Okay, dermatologist for the rash, I believe.
Rash for dermatitis herpetiformis.
Okay. So, anyone catched any points which he did anything wrong can go ahead.
Dr. Noor, this is Dr. Satish. Yeah. Is there any relevance of asking trauma history?
No relevance.
Yeah. And one thing like asking about weaning, and then when the child started losing weight, at what month, up to 6 months it was okay or not, that
1
would
year
have
she
been
mentioned.
relevant.
1 year she mentioned.
Yeah.
Okay.
No, he asked about the weight loss, it's okay. But weaning history, he did not ask.
Yeah, I was about to ask, but time finished like this.
And then other things like what feed is he taking, what type of feed, like that is also relevant, because it's more of a dietary history. Okay, I might have missed.
He asked about it, but what you are telling is good, no problem. He asked about the food. Still, the child is not on any special diet.
One doctor, she commented, Dr. Nili, I think, she commented many important things: wear bracelet, avoid any discontamination, diabetes mellitus at the time of diagnosis. Yes, First, you explore more about FTT, then loose tool, then rule out differential, then association and complication. Very nice. Then complete dietary history. Yes, very nice. If you can open and tell, it will be very nice. Yes. Okay.
What is EFT? What she has written first?
Failure to thrive.
About
Failure to thrive. Failure to thrive.
failure to thrive.
Yes, yes. I relied on the GP. She wrote, I think you could have explored more about failure to thrive, loose tool, then other differential, then associations, and then complications. Certainly, if you can open the mic and can tell, will be better. But this is what she mean, I think. Then complete the dietary state, epismelitis at the time of diagnosis, and wearing bracelet. Okay.
Any other comments before we go to the guidelines?
And I read somewhere like at CELAC, this is, we have to counsel for the financial support is very important because it's very expensive.
Very,
It's
very
gluten-free
expensive.
diet. During
Very
the
expensive.
management also, we have to ask for the financial, in the management also, not only during the history. It's important to mention.
Yeah, means the social support and the financial support, both we have to mention. I think these children slowly, once they are diagnosed and confirmed, they will be connected to the support groups, and they can also receive daily living allowance, right?
Disability living allowance. So what you how we can ask regarding the financial support? You mean, Dr. Fatima? Like, are you receiving any social support like this? You mean,
You
what
can
is the
ask
framing?
about, the financial support only. They will be connected.
Okay, are you receiving any financial support? That will be fine, right?
Yeah, you can ask like this.
Okay. Okay, fine. So can we move to next? This video you have, right? Tell me about your financial circumstances.
So here celiac disease is underdiagnosed due to varied presentation of clinical signs and symptoms. This advice guide provides new and updated summary guidance for the European Society of Pediatric Gastroenterology and Hepatology and Nutrition on diagnosis children and adolescents with celiac disease. So what's new in 2020 guidelines? For initial testing, so to start with, whenever you suspect celiac disease, for initial testing, you will start with combination of total IgA and IgA class antibodies against transglutaminase. Okay, I don't know why he is not using the word tissue here. I am not sure, but he has
Same, Dr. Noor, same. Tissue transglutaminase, same.
Yeah, but why he's not using the term? But till now in Mark and all, we used to read the same thing, right?
Actually, they use the short term.
Okay, so combination of total IgA and IgA against tissue transglutaminase, we will check. Okay, is recommended as this is the most accurate and cost effective. So to start with, you will not do this EMA IgA or DGP IgG need not to be tested initially. Then there is no biopsy approach. For no biopsy approach, diagnosis is confirmed to be safe in children with high TGA values more than 10 times the upper limit of normal with accurate appropriate tests and positive. So you have to send a second sample for positive endomysial antibodies before you will give the confirmed diagnosis, right? So you did IgA, total IgA, and the tissue transglutaminase IgA is more than 10 times. Then you will send a serum second sample for endomysial antibodies. And if it tests positive, then this is the no biopsy approach for diagnosis. But the children with positive tissue transglutaminase IgA but lower titers less than 10 times the limit of normal should undergo biopsies to decrease the risk of false positive diagnosis. Here he gives clearly that HLA testing and presence of symptoms are not obligatory criteria for serology-based diagnosis without biopsies. So now they are not worried about symptoms and HLA testing because sometimes as we read here in the first paragraph, celiac disease is underdiagnosed due to varied presentation of clinical signs and symptoms. So they are going with total IgA and tissue transglutaminase IgA more than 10 times. And you will take a second serum sample for endomysial antibodies. If all these three is positive, you will diagnose the child as celiac disease as the no biopsy approach. If it is not clear or anyone wants to add anything, can go ahead.
So for family member, we should do HLA, you mean, to screen them like this?
We will read it. There is still further about it. I don't know. Mostly if the family member is completely symptom free and growing well with no loss of weight, do we go for screening?
Yes,
no.
yes.
We will go?
Yes, because there is a iceberg theory in celiac disease because this is the iceberg, okay? This is the iceberg. Only tip is visible. But this is the latent squint. Okay, they are the family members. So for that reason, we actually screen all the family members, especially the first degree relatives, father, mother, brother, sisters there.
Okay, now in our case, the child had two elder siblings and they are normal, growing well. and they are fine. This is the third child who has the problem. So now we will screen them, the elder
Dr.
one.
Noor, please try to erase.
Actually,
I cannot erase. Please
yeah,
try
we have to
erase them.
screen whole of the family because there are some silent celiac member, and don't wait for they become symptomatic. If they are asymptomatic celiac in the future, means we intervene at the same time, and we made them exclusive this gluten-free diet, so
Yeah.
we can prevent them in the future. This is
So
the main purpose of.
suppose you found DQ2, suppose you found DQ2, DQ8 positive in the sibling, what you will do next?
If
Do
they are
gluten
positive,
challenge
we
test,
put
right?
them on gluten-free diet. If they are asymptomatic,
No.
but DR2,
Not this DQ2, DQ8. I think you should
Asho.
give them gluten challenge test, and after gluten challenge test, if you will follow the serology, if it is less than 10, then like this. I think so. Not
that was
solely on the
old.
basis of HLA,
That
DQ2,
was
DQ8.
okay. We will confirm, but that was old before. But the new SFAGAN guidelines, I think so. There is no need for challenge. Once it is because positive, it means khalas. We proceed with
challenge
this.
is
The
very
new one,
dangerous.
the new
Challenge is very dangerous. They can create anaphylactic reaction.
Who create anaphylactic reaction?
Why? This gluten will create anaphylaxis also if you do
Okay.
challenge.
This will be done under the hospital setting. I think, can you please, Dr. Fatima, can you please read the guidelines, like what to do for the siblings? Like, can you scroll down?
just 1 minute.
Dr. Tamanna, this is delayed hypersensitivity reaction. This is not type 1.
No, type 1, I'm not saying this is type 1 reaction, but challenge is very dangerous. Challenge is very dangerous.
Anaphylaxis is type 1 reaction. This is type 4.
Don't you think I don't know this thing? Anaphylaxis is type 1. I'm saying
No, I am
that
just telling
challenge.
you, no, I mean to say, I just want to revise this thing that
Challenge means
there is no.
challenge is never accepted in pediatric setting. Okay, unless the patient is hospitalized, because there is severe anaphylactic reaction can happen with any food component.
Okay, anyway, so just Dr. Fatima, can we go through the how to screen the siblings?
But what I understand from them is now they are not worried about the symptoms and also this HLA testing. If you do the test, and if the TGA is more than 10 times, along with high IgA and high tissue transglutaminase more than 10 times upper limit of value, they will just check one more sample for endomysial antibodies and they are confirmed. So they will be put on the gluten-free diet, but we will go through, maybe in the next page it is there.
Yeah.
I don't know. I also
will not lead to
erase, but I was not able to, but it's okay. We will read. So
Dr. Noor, just stop and share again. I also cannot erase this. I don't know what is the setting. Yeah, now again, yeah.
Okay, I will share again. Okay, you can see?
Yeah, clear.
Okay, so consider testing celiac disease with the following symptoms and signs and condition. So symptoms and signs we will go through because this is very important when we are taking the history taking. Chronic or intermittent diarrhea, constipation, abdominal pain. So along with diarrhea, you can also ask that anytime he has constipation, don't miss this history. Dr. Krishna, I told you this. Chronic or intermittent diarrhea, constipation, abdominal pain, distended abdomen, recurrent nausea or vomiting. So main all gastrointestinal symptoms will be there, including diarrhea, constipation, abdominal pain, distended abdomen, and recurrent nausea and vomiting. Then extraintestinal symptoms, you have to ask is the weight loss, failure to thrive, delayed puberty, but this child was 4 years, so you will not ask this. Amenorrhea, irritability, chronic fatigue, neuropathy, arthritis, arthralgia, chronic iron deficiency anemia, decreased bone mineralization, that is osteopenia, osteoporosis, repetitive fractures, recurrent
So we should
stomatitis.
we should focus on with particular like why neuropathy, vitamin E deficiency, why the site of absorption of iron is duodenum, so it is affecting duodenum, plus calcium, the mineral deficiency. The iron, calcium will cause bone demineralization. The vitamin E will cause neuropathy. All this because of the vitamin deficiency.
So in
Abscess, stomatitis
malabsorption
because
due
of
to villus atrophy.
yes.
Malabsorption due to villus atrophy. Okay, so
Yes.
Dr. Krishna, you did not, sorry, it was prayer time. I forgot. You did not ask in the history regarding this fat soluble vitamins deficiency. All the mineral
didn't
also
ask.
deficient.
I didn't
That's
ask.
just like the same A, D, E, K.
Bone pain I asked.
he asked
Regarding
for the bone pain.
night blindness,
I
bone
asked
pains.
for the reason. I asked for the reason.
Yeah.
I didn't ask for the neuropathy. That is one thing. Vitamin E, I didn't ask. I didn't ask for vitamin K.
A, you asked?
Huh?
He asked for
Vitamin A, I asked.
but he did not
Okay.
ask in particular.
Night
Yes.
blindness is the first sign for vitamin A. Yeah, okay. Thank you.
Okay, so we will continue. Neuropathy, arthritis and arthralgia, chronic iron deficiency, decreased bone mineralization, that is osteopenia, osteoporosis, repetitive fractures, recurrent after stomatitis. So always don't forget about mouth ulcers when you are doing the systemic review. Dermatitis herpetiformis type rash. Rash also is very important. Dental enamel defects. You should also ask for any problems in the mouth, any problems with the teeth. Abnormal liver biochemistry. So he asked me about any yellowish discoloration also, because sometimes associated autoimmune liver disease as well. Specific conditions, first degree relatives with celiac disease, autoimmune conditions, type 1 diabetes mellitus, thyroid disease, liver disease, Down syndrome, Turner syndrome, Williams-Beyron syndrome, and IgA deficiency. So first degree relatives will be more commonly associated with celiac disease. They have to be screened. Then autoimmune conditions associated, type 1 diabetes mellitus, so thyroid disease and liver disease. So in your systemic review, again, you have to ask for any heat or cold intolerance and also constipation and all those things. Down syndrome, Turner syndrome can be associated, IgA deficiency and Williams-Beyron syndrome. So another is the celiac disease diagnosis can be accurately and safely established with or without duodenal biopsies if the following recommendations are observed. Again, he is repeating. Testing for total IgA and tissue transglutaminase IgA should be used for children with suspected celiac disease. Now our child in our case was suspected celiac disease, so you'll start with total IgA and tissue transglutaminase IgA. After checking that the child is consuming normal quantities of gluten, that the child is still on the gluten diet, then you will check these investigations. In children with normal serum IgA values for age, tissue transglutaminase IgA should be used regardless of the age. In children with low total IgA concentrations, that is low for age, less than 0.2 grams per liter, above the age of 3 years, IgG-based test, that is DGP, EMA or TGA should be performed as a second step. Suppose if the child has, he is telling, suppose if the child has IgA deficiency, and even the tissue transglutaminase IgA, you think that it is deficient with the child because there was total IgA deficiency, you will go for the IgG based tests. This is the second step. If initial testing suggests celiac disease, the child should be referred to pediatric gastroenterologist or celiac disease specialist. So this initial testing is clear, or anyone wants to comment? I think this was before also. Whenever the child is IgA deficient, you will go for IgG based testing. This is what you have to remember in general. The value, if you want, you can remember less than 0.2 grams per liter above the age of 3 years. This is total IgA concentrations. If you get so much of value, then you will do IgG based test, because since the total IgA is less, even the tissue transglutaminase IgA will be less in these patients. So it cannot give you the diagnosis. Biopsy. Biopsy should be performed on children with positive tissue transglutaminase IgA, but lower titers, less than 10 times the upper limit of normal. Patient should have more than 4 biopsies from distal duodenum and more than 1 from the bulb during gluten containing diet. So when we do at once, we do all these things, the 5 biopsies.
Sorry, repeat.
He is telling
For
you do more than 4 biopsies from the distal duodenum and
not
from the bulb.
not our job. Let it be like it is.
No,
like
it's done in single setting, because endoscopy cannot be done again and again.
let it be.
Yeah,
Let
yeah.
it
It
be.
is one set with
Not at the
multiple
level of
biopsies.
registrar. Not at the level of registrar.
No, but just
Yes.
for the sake of, if someone.
But for information's sake, also you cannot do invasive procedure again and again.
Yeah,
So
yeah,
even in adult biopsies, you take 4-5 specimens at the same time.
yeah.
On
Yes,
one
yes,
setting.
Dr. Noor, they are same time. Yes.
Yeah, yeah. So more than 4 biopsies from the distal duodenum and more than 1 from the bulb. That means at least they'll take 5 from the duodenum and 2 from the bulb, right?
Bulb means?
Duodenal cap, I think, cap.
First part of the duodenum.
First part, yeah, cap.
Evaluation of
I-
biopsy. Yeah, go ahead.
I heard that 4 biopsy. See, I heard that 4 biopsy total. Okay. Among these 4 biopsy, 1 biopsy should be from the bulb. This was I taught in my course. See here, they are written that more or equal to 4 biopsy from the distal duodenum and 1 or more from the bulb. Okay. So at
So
least
minimum
5.
should be 4. Minimum should
Minimum 5.
be duodenum.
Minimum 5. Yeah.
Dr. Fatima, let us focus
Evaluate.
this. What they will ask. They will ask the findings. You will get 4 findings. You will get on biopsy. Which 4 findings you will get? So
Total
crypt.
venous atrophy and
Crypt hyperplasia.
yeah, and I
Sublim-
think lymphocytic
Sublim-
infiltration in
and
the intestinal
sublamina
endothelium, right?
propria. Sublamina propria infiltrates.
Yeah, and there is one more thing. Four things are there. Subtotal villus atrophy.
Villus atrophy.
Yeah, and
Villus crypt hyperplasia I told. Then lymphocytic infiltration and sublamina propria infiltration,
I
right?
think it's in the endothelium, right?
Sublamina propria, I don't know.
There is one picture for that. We can see it after this.
Plasma cells. Plasma
Yeah,
cells is lamina propria.
Yeah, plasma cells. Yes, plasma cells in lamina propria. Yes, that's all. We should remember this only. Yes.
They are asking the biopsy finding.
Yes, that's all. I think no need to remember all other things. Just like if they ask, they will ask this only. That's all. Finish. They will not go beyond this.
Evaluation of biopsies should be performed optimally oriented biopsies. In case of differing results, tissue transglutaminase IgA results and histopathology, recutting of biopsies and or second opinion from the experienced pathologist should be requested. He's telling if the tissue transglutaminase and histopathology does not match, then you what do you mean by recutting of biopsies? They will do again.
Recutting means when they take the specimen, they will have to again take it from the areas of interest once again. once again from the same specimen, recut it again and try to look at it again, just in case they missed it. Because the finding can be patchy, it will not be exactly smooth throughout.
So from
Okay,
the
fine.
same sample, they will again do it.
Yes, fine,
Yeah,
fine
yeah,
sample.
yeah.
They will do.
This is done
Let
in
them do what.
yeah.
Let them do whatever they want to do. We will do. Like
A
we will.
no
Yes,
biopsy approach is appropriate for children with TGA levels more than 10 times the upper limit of normal with appropriate tests and positive endomysial antibodies in second serum sample. Dr. Tamanna, you know what does he mean by these appropriate tests? What extra apart from these two? Total IgA, TGA, tissue transglutaminase IgA more than 10 times and positive endomysial antibodies. Up also I read he needs some appropriate tests. Maybe the supporting tests like the CBC with iron deficiency, anemia or anything. I don't know what
yes,
that.
yes.
So, asymptomatic children, celiac disease can eventually be diagnosed in asymptomatic children here can eventually be diagnosed without duodenal biopsies in asymptomatic children using the same criteria in patients with symptoms. So now our case child, he had two elder siblings who are asymptomatic, and if they do the blood tests in him and the total IgA is raised and also the tissue transglutaminase IgA is more than 10 times the upper limit with positive endomysial antibodies in the second serum sample, they will be diagnosed.
Yeah,
as
Dr. Noor, they mean here you don't need biopsy. We do in our center also same. They don't need biopsy if your TGA IgA is more than 10 times and you have endomysial antibodies positive. So khalas, you don't need a biopsy. It's a confirmed
yeah, even in
celiac disease.
asymptomatic
Yes.
children.
Yeah,
Yes,
even
he's
in
right.
asymptomatic, even
Yeah.
in asymptomatic, we have the same criteria for our this institute also. They don't do biopsy for that because biopsy is an invasive procedure. So
Yeah.
if you have
She's right.
already you have all these appropriate measures supporting the
Yes.
celiac disease, you don't need to go for that.
And then what you will do after you will keep this child gluten free for 6 months, and then you will take again the sample after 6 months whether the child is improving or not. Okay, because it is a delayed type of this hypersensitivity reaction, not type 1 anaphylactic. This is delayed type 4. So it will take time.
Okay. So tissue transglutaminase IgA cutoff for diagnosis of celiac disease with no biopsy. Tissue transglutaminase IgA serum concentration more than 10 times the upper limit should be obligatory. Only antibody tests with calibrator curve based calculation and having 10 times the upper normal limit value within their measurement range should be used. All patients who are IgA deficient and who are positive for IgG based serological tests should be biopsied. So IgA deficient, but
if you have IgA deficient kids, then you need to go for the biopsy.
You will do, but you will also do the IgG based serology.
Yes, you will do the second step will be IgG based serologies, then you do the biopsy.
Then the biopsy.